Hello, my dear friends. Welcome to Aspire32, and we have been doing a lot of podcasts on various topics. Today's topic is new, and it is the trend in the market in your dental practice, and that is about the digital dentistry, which is currently evolving around the scanner and the 3D printer. And I thought, I'm sure since many of my subscribers may be a young dentist, I would like to discuss this very important topic with a very good friend of mine, Dr. Harsh Shah, who is from Mumbai. Welcome, Dr. Harsh. Thank you for accepting the invite to come on Aspire 32 and speak on this
It
very
was
important.
absolutely my pleasure.
So let me first introduce Dr. Harsh. He's from Mumbai, an amazing practitioner, very enthusiastic, and he has been doing a lot of contribution in digital dentistry. He has been practicing implantology along with almost everything in dentistry, and he has been consulting in Mumbai. He's a key opinion leader for Orikam Healthcare, which is one of the quite amazing company who provides amazing products to the dentist all over India. And I'm excited to hear Dr. Harsh. So my first question is, how is the experience of having the scanner and 3D printer in your daily dental practice?
Thank you so much for inviting me on your YouTube channel. It is absolutely my pleasure to come on this channel. Yeah, so my experience with intraoral scanner, let's discuss this. It was way back in 2021. I first used an intraoral scanner. I used many different company scanners. So initially, I used to get it on the rent or maybe through some my lab guy who used to provide me. So I have used it many different company scanners. So slowly, I was researching myself, self-learning things because during that time, lot many information was not easily available. So tried my best to do. Then came up. Then from Oricam, then one scanner came, Helios 600, which I tried in one of my patient. It was a full mouth case, and that case went really nice. There were few implants also placed in that, so all the prosthesis fit came out to be really fantastic fit. So then I thought of why not invest in this new technology when we are getting good work and like work is also reducing. So then I went in. So I've been using since almost 2 years, we can say. So workflow has improved. Initially, there was a huge learning curve. It was a lot of difficulty which I faced initially, but then slowly now I don't feel any challenges while doing my routine dentistry.
So it has been how many years since you are having this scanner with you and practicing digital dentistry per se?
Yeah, so digital dentistry I'm practicing like since 2 years, but I own a scanner since almost 1.5 years time.
Okay. There is one very important question, since you said initially you had the scanner with the lab, you had it on rent. Then why did you decide that I should have a scanner with me? Because I'm sure it's a very big investment. The amount of scanner, the amount of money you spend for scanner in a small town, it is almost like a setting up a clinic. So why did you think you need your own scanner?
See, buying a own scanner is more important because see, if when we are dependent on someone, like then at our own time we never get that scanner. So like all the time we have to tell the patient, sorry, you have to wait because I have not received the scanner from the company or the lab from whomsoever we are getting it. So always then patient also feels like this doctor doesn't have anything or maybe like it doesn't look good in front of the patient. Plus the tips which they get it, they are never autoclave. So if it is our own, we can autoclave it. So I personally won't prefer putting a non-sterile tip in my patient's mouth. And plus then the main is the time issue. The timing is like every time it is not possible. And maybe like you said, like in small towns, so in small towns, maybe even the bigger labs are not there, so even labs would be equipped with the intraoral scanners. So it is better to have your own scanner for such thing. And now, and with intraoral scanners, like we can practically send it across the globe to any preferred lab of ours, so that we can get the processes in like in a very short time.
Great. So can you tell me what is the approximate range of the how much does this scanners cost? Is there a range?
Yes, there's a huge range. Like the scanner starts from almost 6 lakhs to 20 lakhs around. So depending from brand to brand. So there are many brands. Like the cheapest ones are from Chinese market, and the expensive one are the German ones. There.
Okay, okay. I'm sure there are many dentists who can afford the scanner, but they will always ask this question that why should I have the scanner? My work is already happening, so why should I again invest in scanner? So what is the simple answer for this complicated question?
Yeah. So the simple is with the scanners. Number one is speed. We can do more number of patient in less time. So the productivity increases. So if productivity is increasing, so the revenue is also increasing. Even our horizon increases. Like when I didn't had a scanner, I was not doing aligner cases. So now with the scanners, even I am able to do the aligners. So like so my horizon is widened. So no use of impression materials. So I am saving on the recurrent cost. Like materials, obviously there is a recurrent cost for that.
Yes.
So in this, it is
So,
not there.
so if someone invest a scanner 6 lakh rupees, maybe one time, how many? Because see, this question, return of investment is always there. Some people may say that the scanner is not as a, you should not consider it as a return of investment. It is more for the comfort of the practitioner and the patient. But I'm sure for someone who gets the impression materials, addition silicons, and all, maybe it is 5-10,000 rupees per month, and the scanner is almost 6 lakh rupees. And I believe there is an additional laptop also which you have to purchase along with this, which also cost some amount of some expenses.
Yeah,
Can you tell
around
me
80,
what will be the expense of a
80,000 to
laptop?
1 lakh. 80,000 to 1 lakh.
So it is almost, if it is a 6 lakh rupees scanner, then you are investing
Almost 7
one
lakhs.
7 lakh rupees laptop. That is
Yes.
also required. So,
Yes.
how much time do you think, if you practically ask this question, like how much time you would have to spend to recover this amount? And of course, people ask, is scanner, if you take scanner, you will have to increase the charges of your crown. Does the equation work like this, or you should be keeping the same charges even if you are using the scanner?
Okay, so return to investment can happen like it is very varied thing. Like it depends from practice to practice. So how many number of patients we are looking per day? Like for with the scanners we are treating the patients. So it depends on that. Maybe some people might take 6 months. Some might take 1 year, 2 years. But I feel maximum within 3 years we can get the return to investment of the intraoral scanner. If it is in a budget range like between like with the laptop I'm talking between 7 to 8, 9 lakhs. So in that thing in that range we can recover easily within 3 years of time. And other thing, the scanner is more useful because like patient is more comfortable with word of mouth. He would go and tell his or her friend or family that this doctor used something like a magic wand or something. There was no bad taste, odor in my mouth. I didn't even feel any gag kind of a sensation. So he's very good. He is very very good. So you can go to that doctor for your comfort. So this will help in increasing. So this would help in recovering the cost little faster because we are getting more patients which we might not have got.
Understood.
There are a lot of
Yeah, that
ifs
is
and buts.
something which we don't generally think that way. We
Yeah.
only think that we are putting this money, so we are only doing this much. So how much,
Yes.
how much will recover?
Yes.
But yes,
What I have experienced in last 1.5 year is that after getting the scanner, like my OPD has increased comparing that same month a year previous to it, or maybe the averaging of the other thing. I am practicing since last 9.5 years in Mumbai. So what the trend which I see maybe in January month, if I am getting maybe 25 new patients. So then after the scanner, I am getting maybe at least 20% more patients. One more thing I would like to add on this regarding the cost of it. Like sometimes, like many times, not sometimes, the technician calls up and tells the sir, there is some undercut in your preparation or clearance is less. So kindly rectify those things and make a new impression and send it across. So then again we do it. So we lose in our time. Plus then again that silicone impression material is cost. So again then that also cost gets add on in this. So with this there are few features in the software which can help us identify if there are any undercuts or the clearance is less or not. If it is there, we can just there and then rectify it, rescan that much area, and then we can proceed further.
So, which scanner do you have with you in your current practice?
Yeah, currently I'm using Helios 600, which is from 18th, and it is marketed in India from Orikam India Healthcare.
And is it very big? Is it very big
No,
compared to
no,
like
no.
what?
It is, see, I'll just show you. It is a very small plug and play type. There is no external power source required. There is just a USB wire which we have to plug in to our laptop or a desktop, whatever we are using. So this and there is an additional this is a protective cap. We have to remove that and put one tip over it. This tip helps in scanning. So there is a mirror here. So the camera projects the light. That light is reflected through this mirror and it is recaptured, and then that entire picture is processed in that way. So it's a very small, very light in weight. So very easily, like what I would suggest to buy a scanner is it should be very light in weight so that there's an easy wrist movement, so we can just easily scan and note. There are few scanners which are very bulky and little heavy, and there are external power source. So then even that wire weight also gets add on to it. So it is better to have a light in weight scanners.
But when we say this to many of our colleagues, that scanner is available for 6 lakh rupees, scanner is available for 10 lakh rupees, 11 lakh rupees. There are people who say nahi zaruri nahi hai, ye acha ho, wo acha ho. There is a lot of options. So what is your opinion? Like suppose somebody do not have 10, 15 lakh rupees, they do not want to invest so much. Can he settle for the this range of scanners, or maybe the higher scanners is always better? Is there any special additional benefit for that? In what way they are different?
Okay, see, scanner basically is a camera which records images, which just captures all different images in short frames, and its software just analyzes all those images and it just stitches it together and makes a 3D model. So now all current scanners are working on that same principle. All scanners, like be it the cheapest one or be it the expensive one. So that thing works similar. Only difference which I feel with my experience, which I have seen, is the software. Like some company have a better software because they are there into the market since a long time. So they have their R&D team has researched and developed the software in such a way that there are a few features which are unique with them. So maybe
can you give some example that what will
yes.
be that additional feature?
Yeah, so see, like in Medit Scanner, which is a Korean brand, so they have in their software what additional they have is like we can print the model without having any CAD software with us. Directly, we can print temporaries, we can make there, but it is a very basic design. So like chair side temporization, it is quite useful with that. Then in this Helios, which I am using, in that there is this undercut option. Then we can mark the margin. This is a very unique thing in this. We can mark the margin line. So sometimes the lab technician is confused. Where is our the finish line is there of the preparation. So what we can do is we can mark the margin and send the data. So then he will design the prosthesis according to that marked margin. So the fit of the prosthesis at marginal level would be perfect. So that is some unique feature in Helios. Even this occlusal analysis, like there's a feature called as, we can check the clearance. That is, I think, in almost all scanners there. So in Trios, there are additional softwares which we can buy on yearly subscription basis. So in that we can design the prosthesis or final prosthesis, whatever design we want to do. So it is basically that. And there is one scanner which is iTaro, which is basically orthodontist scanner. Because if they want to do Invisalign aligners, only Invisalign company aligners, they accept the scan data of only iTaro and Trios 3. Because Trios has three variants: Trios 3, Trios 4, and now newly launched Trios 5, which is not yet launched in India, but globally elsewhere it has been launched.
Okay. So there are some differences, and I'm sure that not everybody would require all these features, and general practice, like for day-to-day work, maybe the basic features are sufficient.
Yeah, so day-to-day dentistry, I think what is required is like for a crown and bridge, maybe inlays, onlays, maybe cast partial dentures, all those things for making surgical guides. Yes, for scanning those things, aligners other than Invisalign. All those things can be done with all the scanners, be it the cheapest one or the expensive one.
Mm-hmm. Of course, we all have the scanner, but there are some labs, which may not be that good. So, is it very important that you have a good lab, or maybe the lab which has this facility to accept the digital, impressions? What do you have to keep in mind with that aspect when you are buying the scanners?
So the most important aspect is the lab should accept the digital files, the scan data. Secondly, that lab should have his own CAD software, be it ExoCAD. It should be an open software basically with him. So ExoCAD is an open CAD software which accepts all different companies' scan data in the form of STL, OBJ, or PLY format. So OBJ and PLY format are the color format. So it gives the actual color of our gums, the gingiva and the teeth. And the STL is it is in a monochrome, basically on a stone model color. So ExoCAD is a universally accepted software, like all the scan data can be used. Plus that lab should have his own milling unit and a 3D printer. Yeah, so and lab should be like, yes, the quality should be good, like good machines and good resin and material that lab is using. So not all milling machines can accurately mill the prosthesis, or not all 3D printers can accurately print the models. Even the printers can print, but the resin should be good, like the calibration and everything.
Mhm. How much time does this take to make one scan?
One scan for me after the practice, it takes hardly 3 minutes for a full
And
arc
before
upper and
practice,
lower.
before practice, how much time
First
it used to
scan,
take?
I would tell you my first scan took me almost one and a half hour.
1.5 hours.
Yes.
Okay.
And the more time we take, more inaccuracies it comes. So I was not very confident in moving my hand up inside the mouth. I was a little scared doing that, and something new, and plus it was not my unit. So I was scared like if something happens with that unit, then I would be liable to do something. So that was there. So, but once I got hang of it, then maximum 3 minutes. And for full arch implant, it took me 15 minutes. It takes me 15 minutes now. Like last week or last to last week, I just scanned one lower for full arch for implant. So that time I took 15 and a half minutes, which included the time to place the scan bodies as well. After removing the gingival formers, I started that checking the time. It took me 15 and a half minutes to put the scan bodies also, because two times we have to scan. One without the scan body, then with the scan body. So
Okay.
that much time it took. So it was
one very scary situation would be the scanner falls from your hand. Did it happen any times with you? You
not
think that
with
if it
from my
falls,
hand, but my staff was cleaning it. She dropped it accidentally, but touch wood, luckily nothing happened to it. So I think that 80 products are quite sturdy in the build.
there is one very important question which I keep, which is always there, that people are saying that why should we buy it now? One thing is the cost will reduce, and second thing is new model will keep coming, new technology will keep coming. So someone who has purchased a scanner today, right, and if let us assume after 3 years there will be a new model, or 2 years or a new model, what is the logical answer for this type of confusion?
Everything. So for that way, every year Apple is launching new iPhones. So technically, there is not much difference in the two models. Maybe slight build qualities here and there. Maybe their camera is slightly improving. But basically, the function-wise, everything what we were able to do it in iPhone 13, that we are able to do in iPhone 14 as well. So similarly, in scanners also, like if we compare, let's say Trios has so many models now. So in Trios 3 scans that much accurately only that Trios 5 is doing. Only difference which has come is the size of the scanner has reduced. It has become wireless. Only difference is that. So accuracy wise, there is no difference. The sooner we get into this technology, it would be better for us in many ways. Like one is in front of our patient, our image increases drastically. So that patient only are going to get us many more patients. Then with that, obviously our economics would drastically improve. Then secondly, this tool is very helpful in self-learning. We can learn from our mistakes. The scanner only will show that we have gone wrong over here. So we can improvise. If not in that case, at least in another case, we can do it. If there is no scope of modification, then we can obviously learn in the another case, like we would avoid doing those mistakes. So more faster we adopt the technology, it would be better.
Great. You do have a 3D printer with you, and how much these 3D printers generally cost, and what is the range?
Okay, so the 3D printer costs from 30,000 to 8-9 lakhs. So it depends upon the what technology we are using. So currently, the technology which are available in the market, like which can be used for dentistry, there are 2-3 different types. One is the LCD printer, one is DLP printer, one is SLA printer. So I have a LCD printer. Basically, what happens in LCD printer is there is a LED lights which is there, which is which switches on in between intermittently depending upon what is the exposure time and interval. So the LCD screen captures all those light and it projects in such a way that it cures the entire layer, whatever article we are printing, it cures that one layer by layer. It is basically printers work on the addition principle. Like layer by layer, it is added and the structure is created. So the entire layer it cures. In SLA, it is a point is cured. So it is a laser beam which comes on that specific point. So it cures that point. So I would prefer a LCD printer over the SLA printer because the chances of inaccuracies are less compared to that. Because point by point, so that merging also there's sometimes that shrinkage or how much that can be controlled. So it depends.
So is it necessary that someone who has a scanner should have a 3D printer in their clinic?
No, it is not necessary to have. Why I went into 3D printing is like I can give immediate temporization to my patient.
How much time does it take? When you say immediate temporization, how much time does it take?
So it takes me 5 to 10 minutes to design a prosthesis on ExoCAD. So after doing that, then it takes almost 45 minutes to print a crown. And then post processing takes almost 5 to 10 minutes after that print is over. And then we can just give the, so in and all 1 hour's time, 1 hour 15 minutes maximum, we can give the temporary to the patient. So meanwhile, we can ask the patient to wait in a waiting area, give coffee, magazine. So all those things we do. So patient is also comfortable without teeth. He is not stepping out of my clinic. So at least for anteriors, it was my policy since day one of my clinic. Patient should not go without the teeth outside.
Yeah. No, I think that's very important. Giving temporaries also have a lot of advantages, and I'm sure 3D printing would give you a better fitting than the conventional way. You know, the
Yes,
way we
it
prepare.
gives better fitting. Plus, the anatomy of the crown which we are making it is quite superior compared to that normal way which we used to do with the putty index and all. So sometimes even that also used to break. Then we used to use that repair material to fill in that holes or something which was there. So all those things we don't have to do.
And many times when you are doing a conventional way, if the tooth is half broken, you will have to build it and then shape it, then take a putty. Here you don't have to do anything, isn't it? You simply load the image in the software. That gives you a natural crown design.
Yes, it gives natural on design and slight modifications we have to do as per the case. So that's why it doesn't take much time. So there are many libraries in that. So we can select appropriately which is matching to his other teeth. Or if it's a full mouth, then it is in our hands what type of anatomy we want to give to the patient. So there are many libraries. We can load additional libraries as well in that. So plus in the temporary crown and bridge material which we used to use previously, so that used to get stained like within a day or two. Because in our Indian diet, there are a lot of color food like haldi and all. So it used to become like lemon yellow color within a few days. So with this temporary 3D printed crown, this doesn't happen so easily.
And since you are saying that there is a resin involved, how much does this? Because I'm sure that also cost resin also cost per bottle maybe. And so how much does like let us assume.
So half liter bottle costs somewhere around 16 to 18,000. Half liter crown resin bottle costs 16 to 17,000. But with that we can print almost 300 400 crowns. So per crown costing comes somewhere around 40 rupees, 50 rupees, including the wastage.
Mm-hmm. And what is the shelf life of this resin?
Almost 2 years to 2.5 years.
Okay, so that's quite a big amount of time.
So depending on company to company, company to company.
Mm-hmm.
Sorry.
So do you have to load the whole bottle of the resin at once? Or no, there is a specific quantity of resin you have to pour and then replenish it.
So it depends like how much you want to print, like how many units are there. So if it is not too much, then we can just above the minimum mark in the resin word, that much we can put. At least minimum though we have to put. There are maximum and minimum marks are there. So it depends like how much, how many units. So with experience, so initially I started with the max level. Then I saw it was hardly any resin has been used. So slowly I reduced the quantity. So now I am slightly well versed with how much to put. Only little bit is left behind. But whatever is left behind, we can reuse that. So it is not that entire thing will get wasted.
Here also in 3D printing, again the question arises like the newer technology may come in 3D printers. So what would be the answer for this?
Now I think there is no in near future. I don't see any new technology coming. See, DLP is there, which is a projector-based technology. It cures within a flash because of high intensity. Directly, it directs on the entire surface. So the printing time also reduces because of that. In LCD printer, we have to keep the exposure time slightly higher compared to the DLP.
Okay. So basically, it's a very good combination to have a scanner and a 3D printer in a clinic, and that will help each practitioner a lot.
Yes, and plus the 3D printer will help in making our own surgical guides for implants. So now I've just started entering into that zone, like to design my own surgical guide. I'm still learning on that because for that it is a very precision work. We're doing a surgical work. So slowly I'm going into that. So even I would be printing my guides as well now.
Great. I think I am not an implantologist, but what I believe is there are different types of guides. Some are very expensive. And do you believe that this 3D printing technology can help you to have such kind of guides in your own clinic?
Yes. It would definitely help. Just the planning should be proper, and the calibration of the printer should be done timely basis, so that whatever print is coming out, it is accurate.
Okay. Of course, we have discussed almost everything, but I have a very important question: is that when you scan through a scanner, what are the usual problems you face, and how do you overcome it?
Okay, the usual problem in day-to-day practice, I would first say like for doing a single crown or maybe a 3-unit bridge, so the proximal surface are not coming properly at the cervical level. So that is one challenge. Then maybe while capturing the last tooth, maybe 8 or 7, upper 8 or upper 7. So that time the challenges come, the scanner tip is not reaching that area. So that is one problem which I am facing. Like I used to face, but now I have got some tricks to overcome such issues. And then while scanning a little edentulous area, so that is a challenge with that. And there is one treatment which we cannot do with intraoral scanner. Only one. The rest everything we can do. The one which we cannot do is the complete dentures, because intraoral scanners cannot make a functional scan.
Thank you for telling all those mistakes which can happen, and I'm sure your tips are helpful to overcome those issues. Of course, there are so many scanners, but I'm sure like we have phones and different cameras. What is the important, maybe a feature or something which is very important? Like when we say camera, we say pixels. What is the important thing in the intraoral scanners?
So the important is the accuracy of the intraoral scanner. So accuracy is basically it is measured in terms of mean deviation. So lesser the deviation, more accurate is the intraoral scanner. So currently which I am using, Helios 600 is accuracy is 20 microns. So anything between 15 to 30 microns, it is acceptable scanners. So our impression material accuracy between 40, 45 to 100, depending upon type of impression material and the brand of the impression material.
So this is more accurate than a good brand of impression material.
Yes.
Great.
If rightly used.
If rightly used. Very true. Even but that rule is also there in your impression technique, isn't it? When you're using the physical impression material. And if there is a blood, if there is saliva, do you think the scanners record that area very well, or do you have to take some precautions?
No, none of the scanner would record such cases properly because of that refractive index of the saliva. There's some deviation will come.
And because if there is some bleeding, you can always control it, or maybe you believe that physical material may reach that area, displacing the fluid. But in scanner, it may not happen. So do you think
it won't happen? So we have to use retraction cords, or laser, or electrocautery, or hemostatic agent. Any means which is suitable for our practice, we have to use. So in my practice, even when I used to use physical impression materials, I used to use retraction cord. So that thing I am continuing with that. So that also helps in preventing blood coming out, or maybe gingival fluid coming out. So all those things gets nullified. So that's why I'm getting all prostheses accurately fitted.
So that answers another important question. What is this normal flow like? You take the scan and you send it. So you mentioned ExoCAD. So what exactly, in a brief, how does this whole thing work digitally?
Okay, so let's see the workflow. So in physical workflow, like how we used to after the prep is done, we used to select the tray, then we used to apply tray adhesive to over it, then the staff mixes the putty, we load that. If it is a 2-step, then we take the putty impression, then slightly then make some channels for the light body to flow around with the putty cutter. And then we used to make again the impression with the light body in place. And then we used to send this impression to the lab. They used to pour it. Then once models are ready, they used to design the prosthesis. If it is a PFM, so they used to make that wax pattern. Or if it's a zirconia, then they used to again scan the model and then proceed further. And then the prosthesis was casted or milled, whatever type of prosthesis. Then it was used to get delivered to our clinic, and then it was fitted in patient's mouth. But now with digitally, after the prep is done, we just scan it, send the data to the lab. They use immediately, within no time they receive it. They can design the prosthesis and directly mill or print, depending upon type of prosthesis. And immediately next day or within 2 days, that prosthesis is delivered in our clinic. So it is very smooth and faster workflow. Plus, there is let's talk about zirconia crown. There is no discrepancy there because only that 20 microns ka deviation is there with the scanner, or maybe 30. Let's say the lowest accurate scanner we are taking into consideration. So only that much discrepancy is there, and in that prosthesis is designed and it is made. But then once we take the impression, there is some inaccuracy. Let's say the best material, maybe 40 microns deviation is there. So after that, this stone has been poured in that. So that also has some dimensional instability there. So maybe some expansion or shrinkage, whatever it is happening. So again, some inaccuracies came in. Then again, that is scanned with a lab scanner. Again, that also has some amount of inaccuracy. So in total, there is like if we see then quite a lot inaccuracy happens. So the prosthesis fit might not be that accurate, which we get with that with the intraoral scanner. So again, then maybe some repetitions might happen that crown is not fitting properly or something. So that time gets lost in this entire process. So for one day dentistry, if there is a good lab support, even sometimes if I ask for an urgent crown, so even within a day, my lab provides it to me. So one day dentistry, I can do it for my NRI clients if any are coming. Sometimes it is there, so we do that.
Yeah. That does happen. There are many times patients who are from different state who come here and they say that we are here for 2-3 days. I think this opens up that opportunity if you have the scanner with you. One very important thing in our practice is patient education, and I believe a lot in patient education. Is there any way this scanner has helped you to improve the patient education?
Yes, in many scanners, the software in that there is a feature for caries detection. So like patient doesn't see majority of our patient doesn't bother getting a routine checkup done. So if there are small cavities where it is not paining, theek hai, chalta hai. It is that kind of attitude patients which we get routinely. So in such cases, I am scanning for say 362 for a crown. So like I would be scanning, and if there is a caries in maybe 24, so that has come up. So I can show that to my patient that such thing has happened. So if you don't get that filled, then even this tooth might go for a root canal treatment in future. And so we can convert our patient, we can educate them regarding that. If there are calculus is there somewhere or some stains is there, if it requires a profile access, that we can show because it is just image. So a screen in front of him, that patient can see by himself. If there are any spacing is there, so we can ask him like with aligners this can be sorted. So we can educate them with that thing. So there is some feature in software that there's ortho simulation. So like after the scan is done, so this AI technology comes into the picture, and then it shows tentative thing. It is not the accurately, but tentative is after the aligners, this your teeth might look this way. So even patient gets motivated. Oh wow, this is quite interesting thing. So he might get converted for that. And even there is some scanners have smile simulation as well as a feature. So if the smile is not good, so we can simulate the smile and just show that this way your smile can happen after doing smile designing. So this would help in educating our patient. Then this even helps for communication also.
Do you send an image or a video once you scan? I'm just asking this question. Like, do you think people can come, the dentist can communicate with these images or send on WhatsApp? Is that possible?
Yeah, we can do that. So the scan data, if you want to send, there are options to take a screenshot and send to the lab, or maybe if that patient also sometimes demands, like some patients have weird demands, so they need all those things. So even that screenshots can be shared to them. Plus, in Helios, there is one option to take 2D images. Like after the scan data, everything scanning is done. And last stage, there is one option. So if we click that, and then after that, we have to select the tooth of which we need a 2D image of it. So the actual image is saved in the folder where the entire scan data would be saved. So it helps in the technician to replicate the morphology of the adjacent tooth. Supposedly we are doing a crown for say 2-1. So if you want to replicate that 1-1 tooth number, so that image would help the technician to do that. Plus there is option for that margin line, so that which we previously discussed. So that will help the technician to understand the margin in a better way. So this overall helps in communicating with the lab.
So I'm sure this is my last question to you. You may, of course, regardless how much money we all have, but then when you want to spend 7-8 lakh rupees, we all will think twice. Some of us may be apprehensive. What were you apprehensive, before, like when you are planning to buy this, and do you think that people do not have to think twice to get into this digital dentistry?
I was into that way like for almost a year because when I started seeing the scanners, like I want to go into this, that time the price range was from 12 lakhs to 20 lakhs. There are only few scanners which were available. So the cheapest one was for 12 lakhs that time. And that was not very amazing scanner. It was a very slow scanner. So then I was not very keen in that. So then a better one was for almost 15 lakhs. It was starting. So I was that 15 lakhs was too much. So then I waited. Let's see if something happens or that. And then all of a sudden I got this one, and it was at a very good range for 7 lakhs. I got it. So, and plus the laptop was for almost 1.25 lakhs because I went to a little more higher specification one, which is my recommended. It should be little slightly higher than the company claims. This much is minimally required. So in case in future some updates come, so our specification is not less for that. So we don't have to change the entire system, only just for that update. And best one with this scanner is we get free updates, so it is not chargeable. Now none of the companies charging for updates, so that is the best part. Initially that was there. Yeah, every update used to be costing some amount.
Oh, I really thank you for giving me all this information. I'm sure with the information what you provided, there would be some clarity, and I know that you have been a very humble, down to earth guy, and whatever information you have shared today will be very genuine, and practitioners can definitely I can watch that whatever Dr. Harsh has mentioned it here is would be very. So it was amazing catching up with you and listening about the digital dentistry, and I hope to hear more from you in future about newer technologies. And thank you
Yes,
once
sir,
again, Dr. Harsh,
definitely.
for giving me your time.
Definitely, it was entirely my pleasure, and thank you for inviting me for this podcast. It was my pleasure joining you.